So what I want to say in the beginning, that the reason I wrote this paper about 10, 15 years ago, I can't remember, the reason was that my observations on a lot of patients who were coming and with a set of symptoms, and when I was investigating the case and going back into the previous life conditions, I found out invariably that the present symptomatology was due to what they have been through, these people in their life. And this was the end result in their health. So, at the same time, my observation was that such people, they have been using a lot of medications that all of them, they had side effects. And when I inquire about this idea of side effects, and to find out if anybody would care about side effects. There would be papers and more noise about side effects of all these drugs that they were taking. And so I realized that what he was presenting, the case, and most of the cases I have seen were chronic cases with severe pathology that was not ameliorated by conventional medicine. So there were serious chronic conditions. And I was trying to understand how much was due to the previous health conditions of the patient, and how much were due to side effects that were left after treating the different conditions. So, to my amazement, there was no special care on the part of the conventional doctors to care what happens really after they had prescribed the case. And I understood that the only thing they cared were to take away most symptoms of the patient, and that was there. That was what it is. It was. No other responsibility. But when this same patient went after some years to another doctor for another condition, he did the same. He just eliminated the symptoms, leaving the patient behind with deeper and deeper problems, actually. Because there was the realization that what people were suffering were residues from the chemical drugs that they have taken. So I understood, I had the realization that when I treat the case, it's not the symptomatology that matters. What matters was the whole process of the life of the person and how it was harassed. The person with the chronic conditions that was going on, and it was actually more and more deep. So the follow-ups of the cases, they gave me the impression that if a person had experienced a stress at a certain moment, and he managed, either with medicines or with psychological treatment, to eliminate or to ameliorate the situation, what was left was actually something that did not amount to a real pathology always, but most of the times was a leftover of a mental, emotional disturbance of the person. So the patients were living with these disturbances. As long as they could tolerate, it was okay. As long as there was more disturbance, they would reach to a doctor, and they will take some remedies, some drugs actually, that many times it was even difficult to stop these drugs because the condition that was developing was quite severe. But when I found out that these people as children, as young persons, they had fevers and acute conditions. These were up to a certain point, and after that, these acutes were stopping, and the chronic condition started developing. So all this information gave me the impression that the whole of humanity actually was pushed to a deeper and deeper pathology, reaching mental, emotional, and spiritual levels in the final stage. And I was realizing that medicine in general did not pay attention to this condition that was developing in the world, this health state of the people, which is becoming deeper and deeper. So